Although home birth is not easily accessible in South Africa, some women still go to great lengths to seek out a way to birth their baby in an environment that is comfortable, non-threatening and familiar, their home. Jackie Simpson was one of these women.
Jackie, why did you decide to have a home birth instead of a hospital birth?
Well, for me, birth is a natural process and not a sort of a medical emergency. So unless something's wrong with your pregnancy or may go wrong with your birth, I see it as a process that can be managed naturally. And a home environment, you feel more comfortable and calm. You know, it's a calm environment. You can control, you know, what's going on around you.
Tell me a little bit about Charlotte's birth.
We were doing a water birth at home, and the day that we really thought she was going to come, they actually turned the water off in our whole area. So we were on the phone to the council saying, you've got to put the water back on, we're going to have a baby in the water. But she actually, when she did decide to come, she came out very fast. So it was a quick birth with her, and it's the first time I've done a water home birth, and that was really amazing. It reduces the pain by quite a lot when you get in the warm water.
Glynis Garrett has been a midwife for all her working life. Her passion for her work is fueled by the desire to provide women with a better birthing experience.
Who would be best suited for a home birth?
Obviously, pregnancy is a dynamic process and things can change. But if you remain low risk and your baby is in a good head-down cephalic presentation, we will be very happy to continue with the plan towards home birth. But if we start low risk and we develop those pregnancy-induced complications, or if baby during the pregnancy towards the end is not growing so well or doesn't have a lot of fluid, and then baby position, if baby doesn't assume a nice head-down cephalic presentation, we would not entertain home birth.
How does the process work?
I would see you from early pregnancy through to post, right up until after 6 weeks after the baby's born if necessary. But usually all the consultations that you would normally have in any other environment, you would have monthly consultations and checkups. With 2 of those consultations during your pregnancy, once sometimes fairly early and once at 36 weeks would be with the obstetrician. Once we had been rubber stamped for okay, yes, we're still low risk and now we're waiting for labor, we would then patiently wait until you're called. And when you're called, we would bring our host of equipment to the home and see the labor out at home. If we hit a big problem like a postpartum hemorrhage or something at birth we weren't foreseeing, we would transfer in via an ambulance.
Why do you think women are reverting back to this method of giving birth?
I think that women are realizing that a 60+% cesarean section rate is in itself not particularly good medical practice. And so they seek out an alternate choice. It's obstetric care in a labour ward that looks like a clinical place, or it's home birth. We don't yet have that in between.
There is a movement towards providing a more natural or home-like setting in hospitals or clinics for birth, but it may be decades before we see major change.
What advice do you have for other moms considering a home birth?
I would say it's just really important that they obviously form a relationship, find a midwife that they really connect with, build a relationship with her. So make sure that any hidden doubts you've discussed with your midwife, she's explained what will happen in this instance or that instance if this goes wrong, so that you can put your mind at rest. And then just trust the process, trust that your body is designed to do exactly what it's about to do and that you're in very good care.
A home birth allows a couple to manage their environment to suit the mom. A relaxed state often enables a mother to birth confidently and successfully.
For expecting moms, it's good to know what your options are when it comes to birth, and to know that home birth is not just about having your baby at home, but it's about choosing the comfort of your own space to experience a natural process which heralds the start of a new life.
Remember that birth should be safe and healthy. So if you wish to consider a home birth, speak to your healthcare professionals and get a proper assessment.